So today's webinar will be on the opioid epidemic crisis, and today's webinar is brought to you by First Aid OnSite Foundation of America. And today's webinar sponsors are At Home Pharmacy, Dragon Eagle TV, Family Against Narcotics, Washtenaw County Chapter, and American Center of Stem Cell Research and Regenerative Medicine. And hi everybody, my name is Anthony Zong and I'm the Youth Committee Chair of First Aid OnSite Foundation of America. I will be today's webinar's co-moderator with my friend Avi Desai. And this webinar is the first of a series of webinars on healthcare related topics.
Hi everyone, my name is Avi Desai and I'm also a Youth Committee Co-Chair of the First Aid OnSite Foundation of America, and I'm the President of HOSA at Detroit Country Day School.
And today's webinar will be on opioids, and we are honored to have the following speakers today. Our first speaker will be Mr. Mario Nanos, the co-founder of Family Against Narcotics, Washtenaw County Chapter, and he will be educating us about the use of opioids and also share a very, very touching personal story. Mr. Nanos, would you like to say hi?
Hi, everybody.
All right. And that's Mr. Nanos. And our second speaker today will be Dr. Nathan Mayer, PharmD, President and Founder of At Home Pharmacy. Dr. Mayer will talk about the effects of opioids on our health and well-being. And Dr. Mayer, would you like to say hi to everyone?
How you guys doing? Good evening.
And
Hi.
And our third speaker today will be Judge Hartwell, Judge of 43rd District Court. Judge Hartwell will be talking about the legal consequences of opioid abuse. Judge Hartwell, would you like to say hi to everyone?
Great to be here. Thank you so much.
And thank you everybody for joining us today. And please welcome Mr. Nanos.
Well, good evening, everyone. And first, thank you, Anthony and Nicole, for inviting me to participate in this meeting. The timing couldn't be better. We had an opioid addiction crisis prior to COVID, but what the data are telling us is that we have an even worse problem now during COVID. And the reason for that is that COVID is a disease of, addiction is a disease of isolation. And oftentimes that isolation exacerbates someone's recovery or addiction. So their addiction relapses, lapses, and all kinds of problems associated with recovery are on the increase. So I'm just glad I'm here sharing my story, my family's story, and in particular, his story. That's my baby. He died 2 years ago from a heroin overdose. His name was Yanni. No prior involvement with drugs, no prior involvement with law enforcement or with people like Judge Hartwell. He was an athlete, a AAA hockey player. He injured both shoulders, which is a common injury in hockey. That's what happened to him. He left to go to school in Mount Pleasant to attend Central Michigan University. And, as many of you know who are participating in this meeting, once you turn 18, mom and dad no longer have a legal right to know what's going on in your life. And there are all kinds of privacy laws that protect you against other people finding out what's going on in your life. And that was no different with Yanni. He left to go to school, and as I mentioned at Central, he was experiencing pain that associated with those shoulder injuries. He found a doctor in the Mount Pleasant area to write him scripts for opioids. Within a very short period of time, he became addicted to those opioids. And not long after that, he recognized, after first being scripted those drugs by that physician, he realized that he was addicted to them. He contacted several of his friends and he said, I got a problem. I'm addicted to these drugs that were scripted to me. They're very expensive. So I'm transitioning to heroin. I got this. Don't tell mom or dad. And none of those people did tell mom or dad. I won't go over the details with you of what followed, except to tell you that about 15 months later, Yanni was dead from a heroin overdose. And I miss him a lot. One of the things I do usually before I start this kind of meeting, and I speak at a lot of different places, at high schools, sport teams, at hospitals, in front of physicians, in front of judges, law enforcement, is I ask this question of everyone. How many of you, your life has been impacted by someone with a substance use disorder? And I'm here to tell you that when I ask that question, usually I'm in front of people and they raise their hand and I can quickly tell. I can't do it via Zoom, but in the chat feature, let us know if addiction is close to someone you know, a friend, a family member, because when I ask that question, usually it's never less than 75% of the people are impacted by it. And that's why this problem is linked to all of us, either professionally or personally. But it isn't like that, really. There's a stigma associated with the disease. So oftentimes people don't talk about it because they're embarrassed about it and they sweep it under the rug. And so with my life now, I co-own a diabetic supply business, and that keeps me real busy, especially now during COVID. But my goals now in life are to, number one, stay as healthy as I can. Number two, to work hard to help my wife and my son get back on track. And number three, to work to help other families and people avoid where I am and where my family is right now. And I'm able to do that through Washtenaw Families Against Narcotics, where we work very hard to educate and to provide access to care so this disease no longer gets swept under the rug. And before I pass it on to whoever is next, if you ever want me to come and speak wherever you are, I'll do it as long as it's free on my calendar. And I'm so delighted to know that Judge Hartwell is on this Zoom meeting, because some of the best people I've met since my son died, who are committed to helping people in recovery, are judges, prosecutors, lawyers, police officers, sheriffs. They care a lot. And I think one of the reasons they care is that this impacts their lives too, as I mentioned earlier. So thank you very much for zooming in. If any of you have any questions, there's a whole lot more to my story and my son's story, and I'd be happy to answer those questions. So thank you very much.
Thank you so much, Mr. Nanos. That was a very, very sad and touching story. And I'm sure many of us were affected by your story in a positive way. Well, yeah, thank you so much. Our next speaker will be Dr. Mayer.
Fantastic. And Nicole, do you have the slides for this also?
Mrs. Chen, you're muted.
Nathan, are we gonna start? So is this your first slide? Oh, this is your first slides, right?
Yeah, it'll be the first slides. Yeah.
Okay.
You can share your screen and then I can.
Yeah,
I can do
sure.
You know what? I'm having trouble too. If I share this screen, then my both computer monitors will be only see the PowerPoint. I cannot admit people in. This is the reason I have to use this kind of. Yeah, I have to show people slides in this way. I'm so sorry, everybody.
Okay. I can talk about without slides if that's okay.
But I can play your slides.
Okay, fantastic.
Thank you.
Yep.
Can we start now?
Yeah, fantastic. Yeah, so
Okay.
I don't have the slides in front of me, but I give a brief introduction about myself. I am an owner of a pharmacy in outside of Ann Arbor. I'm a pharmacist, been a pharmacist for about 10 years. Been all over. Been in graduated from University of Michigan. Lived in Austin, Texas for a couple of years. I was in China for 5 years, and came back to Michigan about 4 years ago. Started my own pharmacy, and just coming back from China to the United States was getting back into the working environment was a interesting transition. Working inside of a pharmacy, and I would see these prescriptions come through, people getting hydrocodones, number 120, getting oxycodones, and just as a brief intro, those are all the opioid medications, and way above the clinical amount that somebody's supposed to be getting. And it was just an eye opener for me. And we at the pharmacy I worked at, this is a pharmacy in Texas I worked at. People would come in. We had a guy overdose in the parking lot, and we had one of my coworkers. One of the medications that was given was his wife's ex-boyfriend had OD'd, and I think he passed away right after. It was just a complete mess, and it wasn't something that I liked and wanted to take some action. I'm also on the board with Mario with the board of Washtenaw Fan, and I think that with opioids, it's getting to the root of the problem. The root of the problem is education, and teaching youth, teaching anybody who's about to start an opioid medication about what the effects are, what are the chances of getting addicted, what are the risks associated with it, and with taking opioids, you can take them, but it has to be in low dose, has to be in short timing. And this is what the education's about. I can get going too about, Nicole, the slides, I'm unable to get them. Do you want me to just keep on going? Is that okay? Good, I'm just gonna keep on going. That's all right. So getting into, what is an opioid? How does it work? Essentially, when you're with opioids, there's different receptors inside of your brain, your spinal cord, and within your gut. And by what happens, you have the binding that goes on, and it causes euphoria in the brain and causes these needs, or it causes the sensation of need. And when your body doesn't have it, you need it, and you need to get more of it. And that's where you get into the addiction side of it. And the addiction can happen fast, and it depends on who the person is. It can happen within 1 to 2 weeks. It can happen within a couple doses. Getting used to it and needing that drug to go through your day. And the reason people get it because they go through these withdrawal effects. They go through nausea. They get vomiting. They feel bad. They need the drug just to get through their day. And it hits a point where they're not even getting high off these medications. It's a point where they need it to just function throughout their day to get through. And in a lot of cases, what happens is they patients start on these opioids, whether or not it's through a dentist or whether or not it's through, sports injuries or whatever it may be. And then all of a sudden they can't get these medications, or a doctor might cut them off, and then they're stuck between a rock and a hard place. And that's when in some cases people have to go to the street. And when they go to the street, that's when it gets really bad. And that's when it's a scary situation, is because when you go to the street, you don't know what you're getting. And they're mixing within heroin, they're mixing fentanyl, they're mixing another elephant tranquilizer called carfentanil. I just talked to Mario the other day, and in Washtenaw County, was it xylophone? I wrote it down, but it's a horse tranquilizer they're putting inside of this stuff. And to take this into perspective, these medications, you have the potency. If you're looking into fentanyl, for example, the potency of fentanyl is 100 times stronger than taking a hydrocodone medication, than morphine. And then to take that even to a bigger perspective, your carfentanil, which is from an elephant tranquilizer, is 10,000 times stronger than the potency of hydrocodone or potency of morphine. And what's happening is a lot of these overdose cases, you're seeing these traces of these drugs, and they come from drug dealers that don't care about what happens. They care about the strength of what these drugs are. They care about how strong it is, because that's their reputation. And unfortunately, it's leading to a lot of issues of overdoses and higher death rates. And that's a scary part. And they don't care. They don't care. They want people to get on drugs. They want people to come back to them. And the scary thing is a lot of the addicts, they find out where this is from, and they want to go and find where this drug dealer is, because that's the good stuff. So scary situation. And ultimately, this is with you guys, future health professionals, guys that are out there that are young and that you're seeing your peers. Speak up, say something, say, hey, don't get involved with this. Or if you see your friend involved, say something, because this stuff is deadly and this stuff is addicting. It can really harm your future. It can hurt the study is done with education. And with your education, obviously, if you're taking opioids, you're on drugs, your grades are going to drop. And if you're within a household of somebody, and they've done studies too, you're within a household of somebody who doesn't have, who's doing opioids, their education levels are going to drop too. They're in an environment that we have people that are on these drugs and they become apathetic to life. And if they're apathetic to life, how are they going to take care of their children? and it turns into a very negative effect in the long term. The other points here, let's see, I guess some let's see, those are the big points. And other things that perpetuate the problem are untreated conditions. People who are, have depression, or they have traumatic events in their life. These are what need to be addressed also. Solutions, we look at solutions to these problems. We have drug takebacks that can be done. We have training for people who are that have overdosed, and to get the Narcan, which stops the medication from being active within the body, stops the drug from binding to the receptor within the body. You have treatment, medication-assisted treatment. You have abstinence, and you have treatment of these underlying depression issues. And also now you have more regulations with stopping the prescribing. I talked about these high rates of prescribing within physicians, and this is almost non-existent now. The physicians are scared to prescribe these drugs. They're referring over to pain specialists. So these are a lot of things going in the right direction. However, there's still a lot of need, and especially now, as Mario mentioned, with COVID, you're getting to a huge problem, which is isolation. And when somebody's isolated, they're more likely to use, and they don't have a community to be involved with. And I just, there's a lot of other challenges with this, but ultimately it's about you see your friend or yourself, and you have pain, or if you get your tooth pulled, for example. I remember when I got my tooth pulled when I was in high school. What did they give me? They gave me Vicodin ES. They gave me this high strength Vicodin. I probably didn't need it. I would have been fine with ibuprofen. I took it. It made me sick. But anyhow, there's if you're in a situation where you're in pain, try to use the over-counter drugs. And if you are in pain, say if you're in a surgery, God forbid, then take a lower dose. Try to get the over-the-counter medications. Try to use as less of this medication as you possibly can. And just, if you're at a party, right, stay away from this stuff. Someone has it there. Just don't do it. Don't take the risk. Don't play with fire. It's not worth it. And I just want to take a second to plug Washtenaw Fan too. I think they're doing a fantastic job. They're addressing a lot of these problems. They're bringing communities together and looking for people to be involved. And this is a huge problem. Mario's done a great job. He's got a lot of programs, and I'm sure he can off the presentation to talk more about it. There's a program called QRT where you have people going to homes and talking to people who have gone through overdoses and providing them with education and counseling opportunities. And it's just really awesome what they're doing and what's involved. So I think is
it possible to chime in and add something to Nathan?
Yeah, please do, Mario. Absolutely.
So Nathan and I shared board seats at Washtenaw Fan, and I wanted to reiterate something that Nathan said because it's very important. We know that many of the people who are on this Zoom call know people who have an addiction. And it can be, don't let our name fool you. Families Against Narcotics. We're more than about narcotics. Alcohol is a drug. Everybody knows weed is a drug. Obviously, cocaine is a drug. Heroin is definitely a drug. These things are out there, especially now with marijuana being legal. It's bringing all kinds of problems into the judge's court that I'm sure he'll go over at a high level, no pun intended there. But the thing I wanted to say that Nathan mentioned is that if you know someone who's battling an addiction, don't stay silent. Because if they pick the wrong drug, death is a very real possibility. And so if you need help on, being coached on how to frame that conversation with someone close to you, a friend, a family member, call Nathan, reach out to us at Washtenaw Fan. That's what we're here to do. We're here to educate and in that manner. So Nathan, appreciate you bringing that up.
Yeah, no problem.
Especially knowing that I think this Zoom call is, predominantly younger folks. And one other thing, when you're at a party and somebody offers you something, no, don't do that. Hang out with people who have your best interests at heart, and run the other way from people who don't. With that, I'll turn it back over to you, Nathan or Nicole.
Yeah, I think that's a good summary. I mean, I think with the crowd, with you guys, I completely echo what Mario says. I mean, this stuff's not worth it. I mean, you can get addicted, the first couple times you take it. It's not worth it. And seeing it within pharmacies, it's ugly. You become this. You become a slave to it. It owns you, and you don't want that to happen to you. And a lot of you, I know a lot of the people on the line are coming from backgrounds. You're trying to get into college. You're trying to have good careers. I mean, you don't want this to happen to you, and it's ugly. We see it all the time. It is getting better, and there is some hope, but I think just a going away statement to just get started, and you'll hopefully have a successful career and a successful life.
Thank you, Dr. Mayer and Mr. Nanos, for that informative talk. And I'm sure all of the young people watching this will take that to heart. Okay. Next up, we have Judge Brian Hartwell, who would like to say a few things.
Thank you. It's so nice to be here. I'm so moved, Mario, to hear your story and your son Yanni's story. It's so important that you tell that, because it reminds people how real it is, how terrible addiction is. And so for you to share your pain and the lessons you've learned is so meaningful to me and my family. And Nathan, it's really nice to hear your professional perspective too, because you really you're at the front lines of seeing an opportunity to save someone. And that's really how I view my job. I'm a new judge. I'm a judge in Madison Heights, Hazel Park, and Ferndale. It's a district court level. And I started this summer. So I became a judge in the middle of the pandemic. And it's in only limited situations can I send people to jail. So judges across Michigan are being forced to be very creative in intervening in people's lives when they come to a court. So if you come before me, you're probably, we're talking about people who were arrested for crimes, and a lot of them were arrested for possession of drugs, possession of drug paraphernalia. And I'm not going to send them to jail because they're nonviolent. And so I'm looking at tools on how to intervene in their life to save them. I'll go back a step. My philosophy as a judge or a person is that, there's no bad people. There's just people committing bad behaviors. And I think there's a great opportunity for me as a judge to jump into their life and say, what's going on with you? And do you want help, first of all? And so the penalties could be severe. So at the district court level, I'm just handling misdemeanors, which is the smaller stuff. But you could quickly get caught up into a felony where you're facing up to, life in state prison if you have enough, if you're in possession of enough heroin. Actually, any possession of heroin will be a felony. But at my level, it's the smaller stuff, it's misdemeanors. And I'm really going to try to find a way to break into your life, get into your mind. And I'm going to use my staff, city resources or county resources, and maybe some of your resources to understand what brought you to that moment. And, hearing from Mario would actually be, really helpful to talking to some people who I see in court. Because if it's not the police officer and the court and the judge that you're seeing, it could be death. I mean, addiction can escalate quickly, especially with opiates. So what we try to do in my court is there's a lot of medical options. So some people may need some inpatient treatment. And so instead of jail, I'll basically send them to a hospital when they're locked into a hospital with treatment, where they have doctors around the clock to help them. Not just doctors, but also mental health experts to help them with counseling, to try to get to maybe some underlying causes that could be based on emotional health. We also do, throughout my court, a lot of drug testing, just to kind of force people to be clean. And if they fall back into their addiction, they have to come back to me, and we reevaluate what type of testing or systems they need in their life to stop using substances. But even if you come through my court, you have a successful time in inpatient treatment, and you break your addiction, there's still life-altering consequences. I mean, besides the physical and mental damage you could do to your bodies, I mean, you could lose your driver's license. You're gonna have a permanent criminal history that will follow you. That could result in you losing a job. It could result you getting kicked out of college, or a college revoking their acceptance letter of you. Good luck trying to become a nurse or a teacher or a doctor or a lawyer if you have a drug conviction in your background. And if you're filing any immigration paperwork, or you don't have lawful status in the country or permanent status, a conviction could really, really mess up the stability of where you're living. So I mean, the joke when I see my friends or I meet new people, they're like, "Oh, Judge Hartwell, I hope I never see you again." But like Mario said, judges can be your last chance of intervention to kind of get back on the straight and narrow. And so that's how I have viewed my limited time as a judge. And if I get to continue in this position, it's going to be how can I help you? Do you want help? And we'll explore what resources we can find for you. Thank you.
Okay, thank you, Judge. Thank you, Judge Hardwell. I would also like to say a few things on information that is relevant to our current situation that's affecting us all around the world right now, which is COVID-19. The coronavirus is affecting the opioid crisis in a way that no one could have predicted. The New York Times actually labeled the coronavirus a national relapse trigger due to a surge of opioid abuse. The stay-at-home order has pushed a lot of people working towards sobriety into isolation, which can be extremely tough for individuals battling addiction. Treatment has also been a lot harder to access during this pandemic. A recent urine analysis was performed by Millennium Health, which had 500,000 urine drug tests performed, and the resulting trends were really scary. There was an increase of 32% usage for non-prescription fentanyl, 20% for methamphetamine, and 10% for cocaine. Drug overdoses have also increased by almost 20%. Among the bad news, though, there is light at the end of the tunnel, and there have been a lot of new innovations in addiction treatment amid this pandemic. And now that our country is slowly adjusting to the coronavirus and it's slowly getting better, it has become easier for patients to get the treatment they need. And there are many ways to rehabilitate while social distancing as well. Teletherapy or telemedicine is a new form of communicating with medical experts on anything an individual will need assistance with, and gathering groups while social distancing and medication finally being sent out. The best thing that we can do right now is to move forward. So if you know anyone who has an addiction to opioids or any kind of addiction, please reach out and use any of these new social distancing ways to rehabilitate or anything like that. Contact Family Against Narcotics or anything. Thank you.
All right, thank you for that, Avi. And I believe that would be the end of our presentation. And if anybody in the audience, if you guys have any questions or anything, just leave it in the chat, and we can answer your questions to the best of our ability.
Yeah, we are running a Q&A session here. So if anyone has any questions, just type it in the chat, and we can I'll pick them, and we can ask our professionals right here on if you have any questions. So we'll just wait for any of you to ask.
Can I add something?
Yeah, of course, Mr. Nanos, of course.
So, you know, and Judge Hartwell, if you're interested in this, I'll pass it along to you. One of the things that we're doing at Washtenaw Fan is providing yoga for recovery. We started doing it in a yoga studio. This is pre-COVID, and it was so successful that we had to go get a second location, and both classes were packed every week. The judges that we work with, who are both on my advisory board, Judge Charlie Pope and Judge Joe Burke, Ypsilanti and Ann Arbor sobriety courts, respectively, also provide yoga for recovery through Washtenaw Fan, avail it to people that are before them. We also were providing exercise for recovery in partnership with the Orange Theory locations in Ann Arbor. And the reason for that, both yoga and exercise, there's a link between both of those activities and a lower relapse rate. But COVID, as Avi mentioned, is forcing us to get creative. So we're now offering yoga for recovery virtually, and we're about to launch next week on August 18th, virtual exercise for recovery. Both are free. So, you know, this helps battle the problem of social isolation. And it's not the best thing. Look, the best thing is for us to be, you know, in an auditorium where I can see all your amazing faces, and we can make a connection, and I can hear you and see you. But Zoom will have to do until we get past this. But I just wanted to mention some of the things we're doing. And we also have monthly meetings, and we've got an awesome meeting in September that you guys will be getting a save the date flyer for later on. But in any event, we have any questions?
Thanks for the advice. I'm gonna talk to my probation officers about incorporating those ideas. Thank you.
Yeah, you know what's awesome, Judge, is I had this idea for yoga last year. So it's almost, in fact, it's a year next month that we started. And in July, I went to Judge Burke and Judge Pope, and I said, look, I've got this crazy idea. I want to start offering yoga for recovery to people who come before you and to people in the community who are suffering from this insidious disease. And they both said, as luck would have it, my right-hand gal that runs my court is a certified yoga instructor. And from there, we took off. And I would be willing to bet that if you query your team, you will probably have some people who not only practice yoga and meditation, but teach it. So ask around, and I'm certain you'll get a lot of people saying, let's do this.
Thanks. Consider it done. Great idea.
Awesome. So actually, for Mr. Nanos, I would have a question. What could someone do if they are struggling with an addiction and they want to do some kind of therapy or rehabilitation right now amidst this coronavirus pandemic? What could they do if they don't always have access to like Zoom so they can do these types of meditations or anything like that? What would you recommend?
Well, it depends on, you said this person has an addiction, right? Or what?
Well, if anyone is struggling or wants to rehabilitate or do anything like therapy or some kind of things, and they don't really always have access to Zoom or technology like like this or something like that?
So I would answer that question this way. It's really hard right now for people in recovery because the antidote, so I'll put it in COVID terms. You know how we're trying to come up with a vaccination for COVID? Well, the vaccination, part of the vaccination for an addiction is community. It's the opposite of social isolation, which is what is being forced on us as a result of all the social distancing guidelines. So it's really tough. But I would tell people just what I told you guys earlier. To the extent possible, hang out with people who care about you, always in life, and run the other way from people who don't. And I will tell you too, Avi, you know, in this day and age of being connected, most everybody has a laptop or a cell phone. And I know a lot of inpatient and outpatient rehab clinics that are offering addiction care on an outpatient basis right through your cell phone so that you can see your therapist right there. And then there's all these other things that, as I mentioned before, we're launching virtual exercise for recovery. If any of you want to try it out, and you're going to get your butt kicked in a nice way, but it's, you know, those are the types of activities you can do. And I guess lastly, I would finish with this. I told everybody I co-own a business, a diabetic supply business. And my business partner is a personal friend of Atanas Illich and of the, you know, pizza, Little Caesars. And we invited Atanas to come and talk at a meeting we were having at Little Caesars Arena when it first opened. And he came into the restaurant and it was named after his dad. In fact, I think it's called Mike's Place. If any of you have been down to Little Caesars, there's a pizzeria there named after Mike Illich. And if you go in there, on the walls are all kinds of quotes from Mike Illich. And Atanas walks in, and before he started talking to everyone, he said, you know, this is really cool. I've never been in here. And despite being an Illich, it was kind of funny. And he said, this is my first time here. And I've never been in this restaurant named after my dad. But I will tell you that one of the things that my dad believed in till the day he died, and he died not long before Atanas was speaking with us. He said, one of the things that my dad believed in and did right up until the day he died, he said, stay busy doing good things. Live, in other words, live a structured life. Be good and do good. And I will tell you that if you have this disease, substance use disorder, you've got to stay busy doing good things, helping other people, working on your program, going to AA meetings. So I would just leave you with that. Did that semi-answer your question, Avi?
Yeah, of course it did. Yeah. Thank you for answering.
You bet.
I actually have a question for Dr. Mayer. So my question is it common for people who get prescribed opioids for like pain medication and or things like that, is it common for them to get addicted? And if so, what do you think the solutions are?
I guess, yeah, it can be. So I guess in a short answer, yeah, absolutely. I mean, it depends on, there's a lot of factors, right? If it was, you know, somebody now, I mean, so a lot of protocols have changed. I'm going to say 4 years ago when you go to a doctor and you have pain and they would prescribe you 120 hydrocodones for your lower back pain, absolutely, right? You get on these medications for, a couple of days, couple of weeks, you're going to start craving them. You start wanting them, and in terms of now, and it still happens now, of course, but it's more regulated. You have doctors are becoming more aware of this. They're starting to understand that, hey, 120 hydrocodones for lower back pain may not be the solution, and they're cautious also because there's a lot of regulations that are happening. In Michigan, they have the MAP system, and they look at what type of prescribing is happening. So there's more oversight into what's going on. However, with that said, there's still, because they're opioids, because they're strong, they're highly addictive. Absolutely, it can happen anytime, and especially if somebody's not educated, not only by their physician, but just knowing this information, it can happen. Absolutely, and worse off is when there's mixing of drugs. You mix with other, benzodiazepines, right? You have Xanax, and you have drugs like the Razepam. That's when it gets really ugly. But anyhow, getting to the treatment side, in order to get treatment, yeah, I mean, there are options. The challenges of treatment are the number of treatment beds that are available, and that's a big issue. Where if you have somebody that wants to go and get treatment and finally says, hey, I have a problem and I want to get this solved, there's not a lot of open beds to help them, and that's a problem. And then there's a risk there, between the time that a treatment bed becomes open and when they can finally get in, there's a gap in time, and there's a gap there where that person could overdose. So that's a big issue that's going on, and that's one of the problems that's out there. And
I will add to what Nathan said. On our board is Dr. Chad Brummett from the University of Michigan, and he's one of the leading experts in the country on the overprescription of opioids, and he lectures all over the United States, and I think he even travels all over the world. What does he do? He educates physicians on you don't need to be writing this many scripts, that there's a combination of other over-the-counter drugs that showed that they're just as effective as some of these opioids when used in combination with each other. And it's working. I think it was Nathan that said at the beginning that education is key. And look, most of the time when you're dealing with complex problems, and believe it or not, my background is in automotive manufacturing, despite being in healthcare. I'm a Six Sigma black belt. And I will tell you that the corrective action for most complex problems is some form of education. It is. And this complex problem is no different than other complex problems. That's number one. You've got people like Dr. Chad Brummett from the University of Michigan out there educating doctors. And to answer the other question, how addictive are these drugs? Highly, highly addictive. I don't know the exact odds, but if you Google it, you'll see that it's shocking how prevalent people who are scripted opioids become addicted to them. And, one of the data points that I hear Chad Brummett talk about, and we've presented together a few times, and I've heard his lectures more times than I can count on one hand. He says that a child's first exposure to an opioid, you said it, I think, Nathan, it's at the dentist office. So you've got to be very careful, especially if you're a parent. Watch out over your kids, because if you're not doing it, there's a drug pusher out there who is.
Thank you, Mr. Nanos and Dr. Mayer. Yuri Zhang has a question. Any three of you could answer, but she asks, Why are some drugs legal and some illegal? What do you think of the legalization of marijuana? I'm a big proponent for free will where people should be able to do anything they like. Do you think that the criminalization of drugs detracts from human rights? And I also have something to add to ask Judge Hartwell. If someone with an addiction, an unhealthy addiction, is caught with these types of illegal drugs, would rehab ever be offered to them? And would that have primary importance over their sentencing?
All right. Yeah, the goal of my court for drug cases is to rehabilitate. If you have an addiction, that's the goal of the court, not to punish. Of course, if you're selling drugs, yeah, it becomes more punitive. But yeah, people who are caught using drugs and it becomes a criminal matter and they're presented before me for sentencing, my probation officer and I will evaluate every person that comes into my court and their specific needs. So if it's rehabilitation, whatever that means, that yes, that's the goal. It could be inpatient treatment, outpatient treatment, counseling, Narcotics Anonymous, Alcoholics Anonymous, any type of support group. Yeah, that's the goal. There's no one prescription in my court. It's unique to each person.
And then to all three of you, the question in the chat, if you guys want to reread it.
Yeah, I can speak to the legal side and why some are some are legal, some are illegal, and it goes to safety. It goes to the addictive potential. When you look at drugs, they're classified from legal drugs in a pharmacy, from C2 to C5. C2 being the most addictive, C5 being the lowest. C2 being something like hydrocodone, Adderall, C5 on the low end being something like gabapentin. Gabapentin medication a lot of diabetics use for nerve pain. And once you get into the other drugs, they're classified as C1, so meaning they're addictive and they're highly addictive, but then their clinical benefit isn't as good. So that's one of the reasons why they're considered illegal, because the addiction's high and the clinical benefit is low, and you wouldn't use cocaine. But with heroin, and this is an interesting story. This is a history I learned about history. Heroin back in the 1890 was considered the antidote of morphine after the Civil War, but anyhow, that's neither here nor there. But anyhow, but that's in terms of the legalities behind it, illegal drug, not illegal. In terms of marijuana, I think it's good for, it's keeping less people out of prison systems. I think that's good. In terms of marijuana, I look at it. I have two kids. I don't want them to smoke marijuana. And you can look at it. There's been studies looking at the effects of alcohol and marijuana, and a lot of people say marijuana is better than alcohol because there's less auto accidents, or there's less violence associated with it. But I know people that I grew up with that were on marijuana, that smoked weed all the time, and they've lost their souls almost. Like, you can't talk to them. They become distant. They're not there. They're not the same people. I think it takes you over, and look at it from the side. Yeah, you can still live. You'll still be okay if you smoke marijuana, but there's something deeper there that I believe it's not good. And they talk about marijuana also being the gateway drug too, because once you start on something like that, then it can you become softened, and you're like, oh, I want to get to the next high. It's like you go to Cedar Point. You start off with the merry-go-round, right? Then you want to go to the the XL 200 Magnum, whatever it's called. I've been there in 20 years, but you want to go to the ride. You want to go to the next thrill. You want to go to the new ride. And this is what happens. And that's my thought. I think I see it long term. I've lost a lot of friends just because, and like Mario said, you hang out with people who are good. I stopped hanging out with people who were bad a long time ago, and that has made me a better person and much happier. So that's my output on that.
Okay, and Yuri also has another question. She says, I think phone has a very high addictive potential. Why are they not criminalized like drugs are? Is it because phones are more socially accepted, widespread, and popular? Would that mean that the decriminalization of drugs lies in societal shifts in perception, such as the legalization of marijuana?
Well, look, I'm not a legal guru, okay? But I will tell you that you are seeing restrictions being put on cell phones when driving. And it gets back to Nathan's point about when there's safety involved. Yeah, you're going to find Big Brother, i.e., the government, doing something about it. And I don't know about the rest of you, but when I'm driving and I happen to look over here at the other guy, oftentimes, I'm telling you, it's probably 80% of the time, the guy or gal is driving down the road and either texting or looking at his or her cell phone. That is scary. And I would challenge, is it Yuri?
Yeah, Yuri.
Okay. And, you know, I don't know where it's going to end up going with cell phones. You know, another example are video games, highly addictive. And I don't know where that's going to go. Like I said, I'm not a legal mind, I'm not a lawyer, and this is not my area of expertise, but I will tell you that things that are highly addictive are not good for you. And, you know, what's wrong with going out and going fishing or climbing a mountain? Or don't stay on your cell phone, you know? Go do outdoor activity. And if there's one thing that, or one of the good things that is happening with COVID, I don't know about you guys, but anything outdoor related, golf, hiking, canoeing, kayaking, go try to get a kayak right now. Okay, there's back orders all over the place. So it's driving people to do healthier things, I think. But, you know, Yuri brings up some really good points. I don't know if anybody else wants to try to answer her questions from a legal perspective, but.
Anyone?
And I will just add this, the other thing about cell phones, if there are parents on this Zoom call, the path through to very bad actors and people go through the cell phones of your kids and their laptops. And if you are paying the bill for your kid's cell phone or your kid's laptop, you monitor that cell phone activity. You monitor that laptop activity, incoming, outgoing, whatever it is, because that's where bad players will get through to your kids.
Now, I would also like to add a few things about that certain topic is that a lot of the topics to do with cell phones, a lot of it is monitored by parental controls. And even if it's not, a lot of the social media, which is a very big thing now, and it kind of has been for the last few, like 7 to 5 years, a lot of that is age restricted, although a lot of people don't follow that anyways. But it is age restricted to a certain extent. And it does have certain aspects to each thing, like Twitter and Reddit and Instagram and Snapchat, all these different applications on your phone. They all have different applications to them, and a lot, like the whole world uses these websites, right? And to have an age restriction, although it doesn't really do anything, but to have an age restriction for these websites is kind of like the first step to making sure that younger kids don't really start getting into these kinds of stuff until they're like a little bit older and know how to talk on the internet and everything like that. And I think a lot of it has to do with the fact that the cell phone is a technological advance that is kind of, it's obviously a derivative of the phone, right? And I think that's still, although not the main usage of it anymore, it's what it's come from, you know? And I think that has a lot to do with why the phone is not completely banned in the US or anything like that, but there are certain restrictions that these applications on the phone do place. So yeah.
Well, I think too that phones aren't gonna. I mean, aside from the example Mario had, I mean, unless you're texting and driving, phones, it's not gonna kill you. Drugs kill you, and that's a societal problem. And not only when you're on drugs, and it may not lead to death immediately. You have people who have families. And this affects their families, and this affects those children. It affects their future. A lot of people who are on drugs or addicted to substances, it happens to their children. So you have this lineage, and that's where you learn from, is through your families. And you have a lineage of these problems that go on through generations. And that's why it's illegal. And it's hurting your society. And if you have a bunch of people that accept this, it becomes like a plague. It becomes all around. It becomes normalized. And that's why I think, I mean, this is, I don't know, in terms of why it's socially accepted, but that's the problem. That's why it is. I think it's illegal, and it should stay illegal.
Okay, I think that's all the time we have today. So I would like to thank everyone for listening in to this webinar, the first webinar of First Aid on Site, in coordination with Fellingus Narcotics and all the sponsors that we had today. I would like to thank Judge Brian Hartwell, Dr. Mayer, and Mr. Nanos for all coming and taking their time out of their day out of their very busy days to come in and talk to everyone and all of this. And this recording will later be, I think, on the First Aid on Site YouTube channel, I believe, for anyone to view if they didn't catch it all here. But I'd like to thank everyone, and yeah, if anyone else wants to, Mrs. Chen or Anthony wants to end it off on any note.
I just want to say I want to thank everyone for tuning in, and I'd like to thank Judge Hartwell,